Right. Hello, and thank you for joining us for today's hybrid education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop called Exercises for Your Pelvic Floor. If this is your first time joining us, CSC South Bay's mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by communities so that no one faces cancer alone. We serve the South Bay, Long Beach, and Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational programs like this workshop. Educational programs are open to all. If you'd like to hear more about our services or join a community, please visit our website at cscsouthbay.org. Without further ado, I'll introduce our workshop speaker. Dr. Sarah Shimanek is the co-owner of a private physical therapy clinic, Akasha Physiotherapy, located in Long Beach. She's a board-certified clinical specialist in women's health physical therapy and is certified in pelvic rehabilitation. You can see more about information at our website at akashapt.com. Thank you so much, Dr. Shimanek, for being here with us today.
So I muted myself. My cursor isn't. Unmute. There, good?
Yes. Wonderful.
We can all hear?
Yeah.
All right. Got everybody in. All right. Well, thank you all for coming and for being here. Looks like a lot of interest in our pelvic floor muscles today, which is great. So I'm Dr. Sarah Shimanek. I'm a physical therapist specializing in the pelvic floor, women's health certified specialist and certified in pelvic rehab, if you were wondering what the letters stood for. The alphabet soup. And I'm happy to share with you today some different types of exercises for our pelvic floor. So a little bit of an agenda of what we're going to do today. First, we're just going to learn a little bit about why we might do certain exercises. What is the pelvic floor? What's the benefit of doing one exercise versus another one, those kinds of things. And then we're going to try to gain some awareness of our own pelvic floors and when we're contracting and when we're relaxing. And then how to use those muscles in everyday movements and exercises, and then how to relax them. And then we'll give you a little bit of a program of things that you might be able to do at home as well. So first off, what is the pelvic floor? I'm assuming that most of you must have some familiarity with what the pelvic floor is since you are here and came to a workshop entitled Exercises for the Pelvic Floor. However, let's just talk a little bit about what those muscles are. So it's the muscles that are at the base of your spine. Both men and women have the exact same muscles for the most part, with a couple of small differences. As you can kind of see in the pictures on the screen, we've got both men and women, male and female pelvises there. This one is just a female pelvis, because I didn't want to carry both. But so we have muscles that control our bowel movements, muscles that control our bladder, and they're also involved in sexual function. But then these muscles, being at the very base of our spine here, also have a really big role in posture and stability, and they work together with abdominal muscles, back muscles, gluteal and hip muscles, and more to just help support our spine and our pelvis overall. So these little muscles do a lot of things. And when they're not working right, we might have some incontinence. We might feel like we have to go to the bathroom all the time. We might have constipation. We might have sexual dysfunction, or we might have pain or prolapse, or lots of different little things that can go wrong when these muscles aren't doing what they're supposed to be doing. So this slide has a lot of information on it, I know. But what I wanted to just talk about a little bit is that we broadly categorize our pelvic floor exercises into two major categories: exercises that are meant to relax our muscles and exercises that are meant to contract the muscles. Also, I mean, do feel free to take pictures of the slides, but I also sent them to Rebecca and she can send them to you if you request it. So, just FYI. So when we might find that our muscles need to relax, usually it's things that we might be experiencing like pain or constipation, the type of incontinence that comes with stronger urges, or some types of sexual dysfunction, or just feeling like we need to go to the bathroom all the time. Those kinds of things tend to be caused more by our muscles being tense than weak. And so that's when we might want to focus on learning how to relax our muscles. And then things that might be caused by weak muscles, other types of sexual dysfunction, pelvic organ prolapse for women, stress incontinence, so the type of leakage that happens with like a cough or a sneeze or jumping or running or any kind of exercise. And then also just weakness that happens after menopause or deconditioning or, not being as active after cancer treatments and such things, right? Then we might need to rebuild and gain some strength there. And so while there is some overlap between these two categories, and definitely is overlap between those symptoms, certainly plenty of people have things on both sides of the fence there. When we're talking about exercises, we kind of target, one and the other. I also included on this slide, just for your reference, other things besides these exercises that can be helpful for these kinds of things. So for when we're trying to relax our muscles, anything that relaxes our nervous system is going to help with that, so mindfulness, meditation, gentle yoga, any sort of self-care kinds of activities. Actually, doing things like this, being around other people and socializing and connecting with people can be part of that self-care. Relaxing walks, especially in nature, going for a massage, heat, anything like that. It's helpful for relaxing your nervous system, which also can relax your muscles. So those kinds of things are a good adjunct to the exercises for your pelvic floor. And then likewise, when we're trying to strengthen our muscles, these muscles don't exist in a vacuum. Like I said, they do work together with our abs and our glutes and other hip muscles and back and everything else, right? So anything that we're doing to help our overall strength and endurance should also help to support the strengthening of our pelvic floor. And I mean, I listed a few examples here, but I mean, there's tons of different exercises. And in general, the best exercise for you is the one that you're going to do and that you're going to enjoy, so it's not that, Pilates is better than yoga or is better than weights or whatever. I mean, they have different pros and cons, but the one that you like and the one that you're going to do is really the best thing. So any of those kinds of things can help support the exercises and the things that we're going to talk about. So with that being said, I'd like us to start trying to find our pelvic floor muscles. So I'm going to transition to this chair. So I need to stop the screen share. Stop. There we go. And so I want everybody in your chair here. So if you're at home, sit down in a chair. You're probably already sitting in a chair if you're at home. If you're here in this room, just come to the edge of your chair. You can be facing the table, facing away from the table, whatever. Just take a second to kind of get your self-oriented. You want your sit bones to be in contact with the chair and your feet evenly on the ground, so no cross legs and no slouching or leaning against the chair. Okay. And so now that we're all kind of in that general position, we first want to be aware of how to contract our pelvic floor muscles. So when we're thinking about contracting our pelvic floor muscles or doing a Kegel, right? Same thing, just for language purposes. Kegel, pelvic floor contraction, same thing. And Kegel, I don't know. So we want to think about that there's a zipper that goes from our tailbone to the pubic bone, like you're stopping gas and stopping urine and just zipping everything up. And you shouldn't be squeezing your butt, right? If you lift up off of your chair, We know that you did the wrong thing. Yeah. So me looking out here, I should see nothing. No movement at all. Yeah. It should be just something that you're feeling internally, right in between those two sit bones. So thinking about those muscles here, that they're connected to your two sit bones, right? Which you should kind of be able to feel in contact with the chair. If you need to like shift side to side to be able to feel those bones there, these two bones, do that. So they're connected there, and they're connected to your pubic bone and to your tailbone, right? So kind of thinking about a diamond shape there, although they go deeper than that too, but and just thinking about zipping up that part and then letting it go. How are we feeling about that? You also, because your seat is in contact with the chair, you may feel a little bit of a lifting away from that part, from the chair. Yeah. I'm getting a few nods. I think we're getting sort of maybe, and it's okay if it's not perfect. I mean, we're going to keep practicing these as we go, but we want to just try to get an idea of where those muscles are to start with. So once we know how to contract the muscles, then we also want to learn how to relax the muscles, right? So still kind of sitting up in our chair so that we can feel this part of our body in contact with it. I want you to think about taking a deep breath in into your belly and then letting it go. Yeah. And when you're doing that, you want your chest to stay fairly still. Your belly is expanding as you breathe in. Okay. And as your belly expands, you should feel these muscles kind of dropping down. So some people say, some women will use an image of maybe a flower opening or kind of dropping like you were holding a blueberry and you're dropping it. Doesn't make sense to me, but whatever works. I like to think of a hammock here that kind of falls down and drops down, like you're relaxing into the hammock and that hammock is dropping down. And you're not pushing it down, you're just letting it go down and drop down as you breathe in. And for men, you might think of, stepping into something warm, something, where your testicles are dropping down, things are lengthening, yeah? So let's try that breath again with that awareness and imagining these muscles here dropping down towards your feet. And feel free to close your eyes or keep them open or whatever, but take a deep breath in through your belly. These muscles are dropping down, opening, and then you slowly let that breath out, right? And a couple of things that's doing, as we breathe in, when we're targeting our belly, our diaphragm is moving down. And so the diaphragm is the roof and the pelvic floor is the floor of our abdominal pelvic cavities, right? So when the roof goes down, the pelvic floor goes down. I mean, it's pressure, when one goes down and the other has to go down, that pressure has to go somewhere, right? Some of it comes out your belly, which is why your belly expands, and some of it comes down through your pelvic floor if we let it, The other thing that's happening when you take a diaphragmatic breath, as you might feel, your nervous system relaxes a little bit, yeah? So we come out of that, a little bit of that fight or flight, that sympathetic, we need to we're stressed and anxious kind of response, and down into that, oh, okay, we can relax, we can let go. When we are in that fight or flight state, our blood flow and everything is directed towards our muscles because we're literally getting ready to fight or flight, right? And our brain doesn't know the difference between that there's a, lion coming at us, or that we have a deadline at work, or, we have a treatment coming up that we're nervous about. Our brain doesn't know the difference between those things. So it directs our blood flow to our muscles, and that tenses them, So we want those muscles to relax. We need to try to come down out of that fight or flight response, and that diaphragmatic breath helps us to do that. So we kind of get 2 for 1 there with the breathing. It's a really simple thing, though not easy necessarily, but simple, but that's really powerful. That's actually one of our biggest tools when we're talking about trying to relax those muscles. One of our best tools is this diaphragmatic breath, okay? So now we know a little bit of how to contract our muscles and how to relax our muscles. So we're gonna go through some exercises that kind of in a row that you could do on your own at home. And we'll put up slides later and we'll have that can have them listed out, you know, so that you can have that for reference if you ask Rebecca for the slides. But we'll go through them all together so we can kind of talk through them and get an idea of what each one is doing and why. Yeah. So we talked about how those muscles are working together with other muscles. And so we want to do our exercises in two ways. So one, we want to do some isolated, you know, when we're trying to strengthen. So right now we're going to do the strengthening exercises, then we'll do the relaxing exercises after. Okay. So when we're trying to strengthen, doing isolated Kegels actually is helpful, just to gain awareness of those muscles, to make sure we are getting those muscles and that we know where they are, right? But then we also want to incorporate them into other movements and other exercises. So when we're doing the isolated Kegels, we want to think about doing them two ways. Sometimes when people are doing Kegels on their own, they're just sort of squeeze, 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 right? Well, we want to do quick squeezes, kind of like that, but also holds, because we need both endurance and we need quick responses, right? If we're thinking of that maybe we're going to leak when we sneeze, we need a quick response from our muscles to be able to respond to that. And then if we're thinking about, you know, that we just need support for our posture, or maybe pelvic organ prolapse or something else like that, we need endurance from those muscles. And that's also more how we gain actual hypertrophy of those muscles, where they actually get thicker and can support us better, is through the endurance. So first, we're going to try the quick ones. Those are usually the easier ones for people. So we're still sitting up nice and tall in our chairs. If we lost that, we're going to get it back. And we're going to focus back on those muscles. And when we're doing quick squeezes, we still want it to be that full zipper and the full relaxation. So it's not like a pulsing. Yeah. So we're not squeezing and then pulsing. We want to squeeze, let go, squeeze, let go, squeeze, let go. Let's see if we can do 10. What was that? 5, 6, 7, let go, 8, go, 9, and 10. And then take a deep breath and remember to relax those muscles afterwards too, right? You know, thinking about, let's say you were doing bicep curls, you know, and you squeeze, and then if you don't let go all the way each time in between, then each time you're going to get less and less ability to contract, right? So also if you feel that happening as you're squeezing, it feels like you get less and less each time, you might not be relaxing all the way in between, right? We want to go up and down and up and down, not up and down a little, up and down a little, up and down a little, where we then can't squeeze anymore. Yeah. So let's also keep that in mind as we try some endurance contractions. We're going to try to hold. We're going to see for now if we can do 5 seconds. 10 seconds is a good goal, but it's a little optimistic when we're first trying to do these things. So we're going to shoot for 5 seconds. So same general idea. As you're sitting up tall in your chair, you want to think about zipping those muscles up and holding for 5, 4, 3, 2, 1, and then relaxing all the way. Take a deep breath. Yes. And then let's try it again. Zip up and hold for 5, 4, 3, 2, 1, and then let it go away. Take a deep breath. We'll do a few of these so we can practice. Zip up and hold. 5, 4, 3, 2, 1, and let it go. Take a deep breath. Let's start with this turn off, reverting our zinc. And then again, zip up like you're stopping gas, stopping urine, drawing things in. 3, 2, 1, and let it go. And deep breath, relax. Remember, we're letting it go after each one. Let's try 2 more. Zip up and hold. 5, 4, 3, 2, 1, and let it go. I like that I'm not seeing any other compensations from anybody. I'm not seeing anybody up and down their chair. That's good. All right, last one. Zip up and hold. 5, 4, 3, 2, 1. And let it go. And take a deep breath. Let's take a couple of deep breaths and just make sure that we fully let those muscles go. Yeah. So remembering to breathe deep down into our belly, letting those muscles drop like a hammock, relaxing down, and then breathing out. One more deep breath in through your belly. Let those muscles drop down, relax, and then breathe out. Good. Okay. I'm going to assume that you all did a very good job on that. So we're going to move on. So now we want to see, now that we've practiced using those muscles, so that'd be the first part of your, home program here, if you were doing this at home, is to connect to those muscles, do quick ones and slow ones. Now we want to see if we can use some other muscles with our pelvic floor. So one of the muscles that's really strongly connected to those pelvic floor muscles is our inner thighs here, okay? And so we're gonna try to squeeze our inner thighs, and at home you could squeeze a pillow or something. For right now, if you just want to put you can either just squeeze your legs together, or I'd suggest putting like I'm gonna put my fists in between, or you can put your hands in between to give yourself a little bit of resistance. And so what you're gonna think about doing is you're gonna first zip up that pelvic floor, do that Kegel first, and then while you're still holding the Kegel, you're gonna squeeze your legs together, hold for about 3 to 5 seconds, and then let it all go. So you're letting your legs go, you're letting your pelvic floor go. Yeah, make sense? Yeah. And we're still sitting up nice and tall. We're practicing our good posture. I mean, if you have to lean forward a little bit to do the resistance, that's fine, but try to keep your back straight. Yeah. Try not to hunch over. When we hunch over, we're putting more pressure down on our pelvis and our pelvic floor. And that's not really helping with any of the potential symptoms that we could have for pelvic floor. So let's try it again. So we're gonna zip up the pelvic floor, do that Kegel, and then squeeze your knees together. Try to really push, 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 and then let it all go. And then take breath, make sure you're relaxed. And it's important, the reason why we do the pelvic floor squeeze first is to make sure that we actually did it. When we try to do them at this exact same time, when we're still getting used to it, you don't know if you really did it or not. It's hard to know, because once you squeeze the bigger muscle, your sensation shifts to that one. That's the one that you feel, and it's hard to feel if you're still doing your pelvic floor or not. So if you do it first, you're more likely to be able to keep it through the whole thing. So let's try a couple more. So you're gonna zip up your pelvic floor and squeeze your knees together, really trying to activate those inner thighs, squeeze, 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 and then let it go. Yeah. If you're doing it home again, you can squeeze a pillow. You could squeeze one of those little balls, like the bouncy balls that they sell in the stores in the summer that are like big bins, those are good. Or a Pilates ring is the ultimate ideal if you have one of those, it's like the big rings that you squeeze. That gives you some really good resistance. So options at home, depending on what you have access to. But let's do a couple more. So we're squeezing our pelvic floor first, and then squeeze your inner thighs together, pushing against them with your hands or your fists, and squeeze, squeeze, and then let it go. And, with these, I should see you, moving and doing things, which I am. I'm not saying I wasn't. But, all right. So those inner thighs, we're working as part of this, but we also want to work the outer thighs too. So all of these muscles work together to stabilize our hips, to stabilize our pelvis, which helps if we're walking, if we're doing activities. That's what helps keep your pelvis in line, and it avoids extra pressure down on that pelvic floor so that you're less likely to leak when you're maybe walking or jumping or even running, So we're also going to work those outer muscles in the same way. So again, right now we're using our hands because that's what we have. At home, if you had an exercise band or resistance band, you could use that. You could ask a, child or partner to put their hands there. That's a little weird, but, or you can just use your own hands. I feel like it works fine. So we're gonna do the same way that we did the inner squeezes by squeezing our pelvic floor first. So zip everything up, stopping gas, stopping urine, and then push against your outer thighs. So you're pushing them out, but you're just trying to stop them from moving. So I'm trying to apply equal pressure there to stop it from moving. And then let it go. Yeah. Sometimes people will feel like it's harder to maintain that pelvic floor contraction while you're pushing out, because it's like you're doing opposite things. You know, you're pulling in here and then you're pushing out here. I tend to agree. I think it's a little bit harder, you know, so it requires more work for your brain, you know, which is good too. So let's try that one a few more times to make sure we get that pattern in there. Okay, so let's zip up at your pelvic floor, and then you're gonna push out against your knees. So I'm pushing with my hands and my knees are pushing against it, you know, as much as I can. And hold, 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 still holding the pelvic floor, hopefully, and then let it go. Good, good. Both of these exercises could also be done laying down on a yoga mat with your knees up, and then, you know, pushing in or out against something. And again, that Pilates ring is another thing that you can use for the pushing out. It's a nice multi-purpose tool. So, you know, it doesn't matter that much whether you're sitting or laying down. It's whichever works better for you. We're obviously doing it sitting because we do not have room for everybody to be laying down but let's try a couple more. So zip up the pelvic floor and then push against your hands, push your thighs out, push, 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 still holding your pelvic floor, still holding, still holding, still holding, and then let it go. Yeah. All right, now let's take a breath, make sure we relax those muscles. I want you to start noticing too, as we're doing this, if you can tell, when I say take a breath, can you tell that there was a little bit of tension, that you feel like you relaxed a little bit more after, right? And that's part of the process of this as well, is to start learning, when am I holding, when am I relaxing, right? And getting that internal awareness. And that can be super helpful no matter what the issues are that you're dealing with, or even just for general wellness, you know, as well. So, you know, that's something to be paying attention to as we're going through. All right, so next up, we're gonna start to try to use our abs. And I'm gonna get rid of my jacket because I'm not working at night.
Huh? Are you okay with questions?
Yeah, let's try to save them to the end though, I think, because we might get there. So our abdominal muscles, again, are also very important to helping to support our pelvis and our pelvic floor and our spine, okay? So particularly, we want to think about our deepest abdominal muscle layer, which is called our transverse abdominis. And what it does, it's horizontal muscle fibers, and all it does, the only thing it does is to draw in, you know, like a corset, right? Other abdominal muscles cause movements in our spine, like our obliques twist, turn, right? We have a rectus abdominis. It's like a strip of muscle here that gives us, that's our sit-up muscle, right? But those aren't as supportive. Our deeper muscles give us more of that support. And so we want to try to find those if we can while we're sitting here. So what you're going to try to think about, it's almost just as hard or harder than finding the pelvic floor muscles. So, you know, give yourself a break if it's not coming easy. So feel like just let your belly go first. I'm going to turn to the side for the camera. Let me get rid of this. Okay. So try to let your belly go, but still sitting up tall. And then you just want to gently draw in, but not sucking in. So don't kind of let your ribs flare out. You want to try to think about just a gentle drawing in that feels lower down here. And like you're closing your rib cage towards your pelvis, but not collapsing this way either. So our spine stays the same. We're not rounding it. We're not arching it. We're still keeping a nice neutral spine. We're only drawing, just pulling our belly in. Yeah. Kind of makes sense? Yeah? Okay. So now that we maybe know where those muscles are, we're going to see if we can use them a little bit. What you're going to do is drawing those muscles in, you know, I'm using my hands to show, but you're not using your hands unless you need to feel it. Which you can feel it if you need to, but it's not like you're literally holding it in. So we draw those muscles in, sitting up nice and tall, and you want to lift a leg off the ground and then the other. And what we're trying not to do as we do that is this or this. Yeah. We want to try to keep our upper body as still and stable as we possibly can while doing that. And you might find, like, I feel like I can come a little further to the edge of my chair to even do that without moving my upper body. Yeah. So you want to feel like you're holding this muscle in and staying really tall and marching. And it's harder than it looks. Yeah. To do it without changing your spine and without collapsing on each side. Yeah. So do a few of those, holding the muscle in, and see if you can feel it. Good. And then let it go for a second. Great. No, I was feeling it. And then let's see. I might be asking a lot here, but we're just trying to see if we also can hold our pelvic floor in at the same time. Do we think we can do that? Maybe. We're gonna try. It's okay. You know, it's progress, not perfection. Yes, so we don't have to feel like we're doing perfectly at it, but we're gonna try. So when we're using our pelvic floor and those abdominal muscles together, it's almost like that zipper comes up here and then continues up. Yeah, it's like one big zipper, and the pelvic floor and those abdominal muscle, those deeper abdominal muscles, the transverse abdominis, are in a continuous fascial plane. So they share, I don't know if you know what fascia is, the connective tissue that's around those muscles. It's the same, it's continuous from one to the other. So they really work together. In fact, I mean, when they do studies on young, healthy 20-somethings that volunteer for studies at universities, those muscles together contract a few milliseconds before we move, before we do literally anything. They're supposed to contract to stabilize our pelvis and our spine. I mean, after age and potentially children and cancer treatments and all the other things, it may not be happening so much anymore, you know, as automatically. But that's what we're going for. That's what we're trying to do, is to retrain those muscles to do that again. Yeah. So that's why we're going to try to use them together. So let's think about that zipper, getting our pelvic floor and then drawing our belly in and then holding that both maybe while we lift, and just nice, slow, gentle marches without changing anything. Yeah, I mean, really, for those of you in the back who I can't see your legs, I really, hopefully, am not seeing you move at all. I mean, that's a little optimistic, but you know, ideally, that's what you're going for. You're doing pretty good though. And then let it go and give the pelvic floor a break. Let's take that breath again. Make sure we let go of those muscles. Yeah. Harder than it looks, yes. These are the kinds of exercises that, you know, you're gonna be doing at home, and somebody else that lives in your house is gonna be like, "What are you doing?" You're like, "Oh, I'm exercising." They're like, "What?" You're barely moving. But you know it's harder than it looks. So, all right. So that's how you would do that one, trying to engage your abdominals and trying to connect pelvic floor and abs at the same time. Okay. Now, I mean, we're progressing quickly here because we're, you know, this is like a big group physical therapy session. But you know, it's, again, when you're at home, feel free to take it slowly. You know, you would do what is working for you, and you can feel free to progress as you're feeling comfortable, you know. But we're going to try now to incorporate those muscles into a bigger movement. So, so let me show you first kind of what we're going to do. So remember I said how we use those muscles before we move. So that's what we're going to try to do. So you're going to zip up that pelvic floor. You're going to draw your abs in, and then hopefully without using your hands, standing up while still holding all of that, and then sitting back down and then letting it go. So you're gonna find out a lot of information about whether there was anything left to let go at the end, that'll tell you whether you were actually holding it or not, okay? So maybe adjust your chairs if you need to, so you actually can stand up. You don't need much more room than just to be able to stand up and sit back down, but not all of you have that room. Okay, so now that you're there, let's try it all together. So squeeze the pelvic floor, draw those abs in, stand up, still holding all of it, still holding, still holding, still holding, sit back down, and let it go. Good. Yeah, I got a good sweat on it. It's, again, harder than it looks, yeah? So a few things to think about as you're doing it. I mean, again, that was just the first time, so don't feel bad if you didn't hold it all the whole time. It's okay. One thing to think about after you stand up and you're still holding it, trying to go slow on the way back down too. Don't collapse back into the chair. Just because that control is going to be how you're going to build strength. So now we're actually building some strength in these muscles and some of the surrounding hip muscles too. We're trying to do a little bit of both. So we get a lot. If we can do all of these together, we get a lot in one exercise, which is great, but again, it's harder than it looks. Another thing to think about, if you really just can't hold it the whole time, which you might not be able to yet, you can think about, squeezing those muscles in, standing up, letting them go, squeezing them again, and then sitting back down, if that's what you need to do. Yeah. I'd rather you hold them the whole time, and that'd be a good goal, but it's okay to have like an intermediate step in between, Yeah. So let's try it again. Maybe let's try the intermediate, like letting it go in between. Yeah. So squeeze everything, that whole zipper, and stand up, let it go, squeeze it again, and sit back down slowly. Oh, that was a good slow sitting back down. I like that. And then letting it go. Let go. I don't think I said that. So now we'll do one, and this is choose your own adventure. You can either let go at the top or hold it the whole time, depending on where you feel. Now that you did both, see where you're at. So zip up that pelvic floor, pull those abs in, stand up, and either sit straight back down or let it go and then sit back down. Nice and good. If you are trying not to use your hands and just leaving them at your side isn't working, you also can think about crossing them over your chest just to remove any temptation of using your hands to get up, right? If you have to use your hands a little, that's also okay, but just the least amount that you absolutely need to be able to get off the chair, is what we want to try to do, because you're trying to build your glute strength too, So let's try a few more of those. So squeeze the pelvic floor, draw the abs in, stand up, still holding or letting go, and then holding, sit back down, and then let it go. Good. Again, squeeze everything, pull it all in, stand up, still holding or letting go, and then holding and sit back down, and then let it go. Yeah. Two more. Squeeze pelvic floor, draw your abs in, stand up, slowly sitting back down, holding, and letting go. One more. Squeeze your pelvic floor, draw your abs in, and stand up, and slowly sit back down, still holding, and let it go. All right. Ooh, let's take a deep breath. Oh, let it all go. I know I can feel myself still holding tension in those muscles, and I feel like you might need to. So deep breath in, belly expands, pelvic floor drops, and slowly let it go. And again, deep breath in, belly expands, pelvic floor drops and opens, and let it go. Good. All right, are we ready for the next one? Or are we scared? Okay. All right. So the next one, I'll show you first. It's pretty much the reverse of what we just did. So, and some people find it harder, some people find it easier. So it might be kind of just neutral. But basically what we're gonna do is a squat, sort of, but using those muscles in the same way. So this time we're gonna start standing. You can watch me first. And you're gonna zip up the pelvic floor, pull those abs in, act like we're gonna sit down in the chair, and then stand back up and let it go. Yeah. Now, something I really want you to pay attention to. I mean, notice where you lose it as you go down. Yeah. It might be here, and so then stand back up. If you can go all the way where you almost touch the seat and you're actually still holding it, fantastic. But the lower you go, it's gonna be usually harder, especially the pelvic floor is just gonna, let go and not do what it's supposed to do. So, let's all stand up and we're gonna try it. So we're starting with the pelvic floor and the abs, drawing it in, zipping it all up, holding all of that. We're gonna act like we're sitting back down in our chair, so making sure your bottom goes back, and then stand back up and let it go. Did we notice if we lost it in the middle there? Maybe, okay. So let's try it again and make sure we're paying attention if we weren't paying attention the first time, and only go so far back as you can still hold it. And, and just notice if you're holding it. The other thing I want you to make sure that you're not letting your knees come down. We're not going down this way. We're getting our butt back. So your knees stay relatively over your ankles as you're doing it, and your trunk can come forward, but keep your back straight. So we're also not doing, I can't even do it, doing this, yeah? So your back is straight, you're only bending at your hips and your knees. So just make sure that we know what the movement is that we're doing, yeah? All right, let's try it again. Starting from standing, zip up that pelvic floor, draw those abs in, go only so low as you can go, like you're gonna sit down in the chair, then stand back up and let it go. Also, if it's hurting your knees, same kinds of things to be paying attention to. Make sure your knees are staying over your ankles and that your hips are going back. And then same rules apply for only go so far as you can go without it hurting your knees, yeah? So again, if that's a little baby micro squat, then it's a little baby micro squat, and great, good job, but you probably will find the more that you're putting your hips back and not letting your knees come forward, it shouldn't hurt your knees as much, yeah? And really, we're going for no pain in the knees, so don't do it. If you absolutely can't do it in any way without it hurting your knees, then skip it, okay? There's my disclaimer for the day. So, let's try it again with all those things in mind. Zip up the pelvic floor, draw the abs in, come down like you're gonna sit down in the chair, hips behind knees, stand back up, and let it go. It's harder also maybe to let it go when you're standing. You might notice that too. It's like, because we need those muscles to support us a little bit when we're standing. So it's okay if you're not feeling that full release when you're standing up. It may not feel quite the same. Let's do a couple more. So squeeze the pelvic floor, pull in your abs, sit down like you're sitting in the chair, and stand back up and let it go. Good. Okay. While we're standing here, we're going to move on to the next thing. And I want you to think about, well, let me show you what it is and you can decide if you need something to hold on to. So you're going to be slightly bringing your legs apart, and this is the movement, like this, okay? So you might, if you want a little support, could be the back of your chair, could be the table. If you feel like you might need it, then just arrange yourself in a way that is there, available to you, yeah? And same rules apply as all the other things, yes? So we're gonna pull our pelvic floor in, we're gonna pull our abs in, same as we did before. You're only gonna go so far as your knees can handle and as you can hold your pelvic floor, and then you're coming right back up, okay? And I want you to look at your feet, and if I had my feet both directly under my hips, they'd be the same distance apart as when I bring one back, yeah? And then my toes and my heels are still in the same line as each other. I'm aligned with the boards here, which makes it easier that everybody can do that. But just pay attention. You don't want like your legs to be way far out. It's going to be a totally different exercise that might hurt your knees. Or likewise in, but you're probably not gonna do it that way. So just pay a little bit of attention to your alignment. It doesn't matter as much whether you're just a little bit of a step or a big step. That's more to your comfort level and what you can do. Your back heel is going to be off the ground a little bit, yeah? And your weight should be right in between your two legs. So this is our starting point, yeah? And here, we're going to be paying attention again to our posture. It's like there's a string coming out of the top of our head, you know? Keeping our spine nice and long. And then we're going to zip up our pelvic floor, draw our abs in, lower down just as much as you feel like you can, and then come on back up and then let it go. And again, I mean, this one actually is harder. I mean, it's harder on your hips. It's a harder exercise, but also now our legs are apart and we're trying to hold things together in the middle, right? So it's, for our brain, is kind of confusing. But if you can do it, it's even better. You're kind of in one line there. If you could widen your legs apart. There, thank you. All right, so let's try it again. Zip up your pelvic floor, draw your abs in, lower down, and come on back up. Also make sure that your knees don't go in as you lower down. They should go right over your in line with your toes, but not, it shouldn't be where it's going over your toes if you're doing it right. And you're lowering straight down, you're not coming onto the front leg, if that makes sense. Yeah. So zip up pelvic floor, draw abs in, come straight down and come back up. And as you come back up, hopefully you're feeling that your glutes are contracting to help you get there. Yeah. And then we're letting everything go. And then let's do one more on this side, then we'll switch. So zip up your pelvic floor, draw your abs in, lower down, come on up and let it go. And then switch. Now again, we're going to be really mindful of our starting position. So, you know, feet hip width apart, one goes back, so we're not on a tightrope, yeah. And heels in line with toes, and then when your weight is in between your two legs, and when your knees bend, they're going in line with your toes as well. Okay, and it's a lot of little pieces to try to pay attention to. So zip up pelvic floor, draw your abs in, lower straight down, don't let your knees come in, and come back up. And again, same rules apply for your knees. If any of this hurts your knees, don't do it. Okay, let's do a few more so we're even. So zip up your pelvic floor, draw your abs in, lower down, come back up, and let it go. Maybe a couple more. I don't remember how many we did on the other side. Zip up your pelvic floor, draw your abs in, lower down, come on back up, and let it go. Good. Zip up your pelvic floor, draw your abs in, lower down, and come on back up. Good. Those look pretty good. All right, relax. Okay. All right, now we get to focus on relaxing. Yay! You did your hard work for the day. And now we're gonna relax. So, first things first. Now you actually do get to lean back in your chair. So that we can relax. We're gonna really try to relax our pelvic floor with that breath first. Okay. So leaning back in your chair, you're gonna take a deep breath in through your belly. Let your pelvic floor drop and open. And slowly exhale. Do a few more breaths at your own pace, but still nice and slow. Breathing in, belly expands, chest does not. Pelvic floor drops and let it go. Couple more. Breathe in, belly expands, pelvic floor drops. And let it go. And one more. Breathe in, pelvic floor drops, and let it go. Good. Now there's some other muscles that, you know, are around the pelvic floor area that that stretching those can be helpful to help relax the pelvic floor. So there's a stretch that some of you may be familiar with. Now you are going to have to come to the end of your chair again. And it's a figure 4 stretch. So if you can bring your ankle all the way over your knee, then do that. If that's not possible, then find where you can place it. So if it's over your ankle, your shin, or right below your knee, just don't put it right on your knee. But wherever you can get your ankle is fine. You want to still be able to sit up tall as you're doing it. And so if you can sit up tall and then try to kind of gently, you can push your knee down to just deepen that stretch a little bit. If, and only if you're sitting up tall and your knee is, this is pretty much parallel-ish, and you still feel like you want a deeper stretch, then you could also lean forward a little bit, But for a lot of people, you're going to feel enough sitting up tall here and with this, okay? So don't feel like you have to do that. And you want to keep your back straight if you're leaning forward, So if you're already here, your back is rounded as your knee is there, then I want you to first be sitting up tall before you do anything else. And then if you're here, with your knee up, I want you to first be putting your knee down before you do anything else. So just keep that in mind. I think some people go too aggressively into this and you're not getting what you want to get out of it. So sitting up nice and tall, ankle over your knee, this knee down, then you can lean forward if that feels good. And you just hold it and breathe. At home, holding about 30 seconds or so is a good amount of time for a stretch, which if you really look at the clock is a lot longer than you think it is. But we're not going to do quite that much. So let's switch, because we're going to get through all of them and have a little time for questions. So same thing on this side. Put your ankle, and it might feel different on this side, so keep that in mind. Everyone's different side to side. You may not be able to put your ankle as far up. It's okay if it's a little lower. And it's okay if you're not able to lean forward on this side as you were on the other one. But just make sure your spine is straight and that knee is down. And then take some deep breaths. The other really important thing when you're stretching is to make sure you can relax into it. If you're like really pushing it and you're, oh yeah, that feels good, I mean, it kind of does feel good, but you're straining into it and then you're not relaxing your muscles, So I'd much rather you not go as far, but be able to relax into the stretch than to like really strain for it, So that applies to all stretches everywhere all the time, not just these. Good. Okay. Another muscle that's connected right up to our pelvic floor, hamstrings connect right up to that sit bone, right, which is right next to that pelvic floor. So to stretch those as we're sitting, you're going to come to the edge again, put your leg out with your foot flexed, and just with your spine straight, only lean forward as far as you can before you feel a stretch there, right? So, like for me, that's about here. But if you can go a little further. And then move your ankle like up and down, point and flex your toe. So you kind of go in and out of that stretch a little bit. Switch. 5. Same thing, back spine pretty straight, not rounded, yeah. And point and flex. That's good. All right, now coming back to the center here. Also, our pelvic floor is at the base of our spine, right? So any mobility for our spine is also helpful for our pelvic floor. So a good spinal mobility exercise, if you ever do yoga, is a cat-cow, which we can do sitting here, just going back and forth. So what I want you to think about, you're not leaning back and forth, right? you're trying to actually curve your spine. So your spine is like going in a C shape and then it's reversing. So really, your head should still stay above your pelvis the whole time as you're doing this. It's only your spine that's moving between them. And again, this isn't one that you need to like push further than what feels good or feels natural. And if you want to add breath to it, you breathe in as you come up and breathe out as you come down. And then likewise, we're going to do a version of a kind of child's pose or forward fold sitting, but anything like that kind of helps release your spine forward can also be a really helpful position for releasing your pelvic floor. So again, if you're at home, you can do an actual cat-down child's pose if that's something you're familiar with, yeah? I do want to say be mindful of this forward fold or even a child's pose. Make sure your knees are nice and wide. If you have any kind of osteoporosis, try not to round your spine too much. Just come forward as far as you feel like you can without that. So if you need to just rest your elbows on your knees, you can. But if it feels okay and you don't have any spinal conditions, you can try to go all the way down to the floor. And then even just relax and let go. And try to breathe. Yeah. I know. It does, doesn't it? Good. Come on back up. We have one more stretch and then we'll take some, most of our time, maybe. I can be here a little longer if we have it. The other thing we want to stretch is our inner thighs. So when we're here in the chair, if you have room to put your legs out, you can put your legs out and then reach forward. If you were at home, you could do, like a butterfly stretch. Yeah. And your knees don't have to be totally straight. You'll probably feel it even with your knees bent. You want to try to feel it in your inner thighs here. And here I would definitely keep your spine straight, regardless. I think you'll feel a little more. And remember to breathe. All right. We did all our exercises. Yay! And hopefully your pelvic floors feel all nice and exercised and relaxed. I can take any questions. I do have a little extra time if we have it.
Wonderful. Do you want to sit right here or do you want to go back on?
I'll sit here in case you need to demonstrate anything. I think that's fine.
Absolutely. For those online, feel free to put any question into the chat and then I'll come to in person, but I want to just get for those online first. Just so they can hear us.
Oh, sure. Yeah.
I think the mic was with where.
Okay.
Okay, so while the online people are typing their questions,
I think there was one in the back. Yeah.
yes, go ahead.
Oh, I just wondered, would you recommend Suzanne Summers' Thigh Master?
If you can repeat the question.
So the question was, would you recommend Suzanne Summers' Thigh Master? It's actually fairly similar to the Pilates ring for the resistance. So when we were doing the like squeezes, I mean, that would be one that you could use in place of a pillow or a ball or the Pilates ring. It's pretty similar. So yeah, sure. Is the answer.
You can use the band, right?
For the pushing out, a band is good. For pushing in, I mean, you need something to squeeze. Yeah.
Yes.
Mhm.
Can we do these exercises every day or do we need to do them sporadic?
Yeah, that's good. I never got to that slide. So you should be able to do them every day unless you're feeling sore, or if you're having any increase in any symptoms that you might have, because you could be tiring out the muscles if you do them too much. For the strengthening exercises, I'd probably say about every other day is good. But the relaxing exercises, you can do as much as you want. There is no limit. Yeah.
Yes.
I kept feeling like I wanted I needed to hold my breath to be able to keep. Okay, is that
Yeah, so it's basically it's an advanced skill to be able to breathe while you're doing it. So that's a fairly normal thing at first. I'm not too concerned about it as long as you're breathing during the exercise. So like what I would suggest like, let's say you're doing the sit to stand, for example, you know, squeeze the pelvic floor and then maybe breathe out and then regain your breath and then breathe out again. So just maybe pick times to breathe if you're having trouble with it. Just make sure you're breathing at some point, especially when you're doing the big movement exercises, you know. If you're trying to start to hold your pelvic floor for longer and longer periods of time, then you know, might need to find that you learn to breathe during it, but it's kind of a whole other thing. But yeah, but that's a good point, and that makes sense. That's hard to breathe during it. Yeah.
Wonderful. Just a reminder for those online, if you can either put them into the chat or you can unmute yourself and then I will call on you. And in person, yes.
Are you going to send out the exercise that?
So I have the list in the slides that I sent to
So for the
her.
recording, just please email me.
Thank you.
Yes.
Yeah.
Yes.
I'm just wondering if I'm doing it correctly because I'm feeling this ring here and the back.
Yeah, if
Can you
you're
repeat the question?
so she's wondering if she's feeling it correctly because she's feeling it in her back. Probably there is something that needs to be modified. I mean, anything specific like that, there's really nothing else except to go see a pelvic floor therapist and be assessed and have something to be individualized for you, right? This is a very generic program just for wellness. It can be helpful. You shouldn't ever do it if you're having any pain, then you should not be doing the thing. And you should always check, you know, with your doctor first and just make sure, you know, and then if you are having anything that's not feeling right, then you really have to go see a pelvic floor therapist who can, you know, make adjustments for you that are more specific to you.
Just for the presentation purposes, can we share your screen again? Is that possible?
Yeah.
And I do have the slides as well. So if you want the recording and the slides, I'll email them together. Please email.
Oh, there was a disclaimer about that.
You gotta have some point. Yeah.
That's fine. So this was our strengthening exercises that we did. And these were our relaxing ones, more or less. I know. And then I do have some resources here for you. You know, there's 3 different websites there that have locators for the nearest pelvic floor therapist to you, as well as my contact information. If you have any other questions too that you're not wanting to say in public, I'm happy to answer them via email, or actually you can text that phone number too. But
Any
just maybe reference
yes.
it, yeah.
I found out that visiting sauna and swimming is a very natural extension to your sitting classroom exercise.
Can you repeat that?
So she said she found that visiting the sauna and swimming is a natural extension to this, and I completely agree. I think that those, you know, I think on that one slide here, we talked about heat as being a good source of relaxation. I didn't put swimming on the other side, but it absolutely is actually good for both, you know, so I completely agree. Those are really good choices.
All right, wonderful. Last question.
I have 3 questions.
One question.
Okay, the benefits of rebounding in Tai Chi.
The benefits of what?
Rebounding, mini trampoline
Oh,
and Tai Chi.
okay. So, I mean, Tai Chi, so he asked about the benefits of rebounding in Tai Chi. So, Tai Chi is helpful for balance and stability. So it's a really good extension of this type of strengthening work because you can use your pelvic floor and your abs in the same way that we were just doing in Tai Chi exercises. And then it also is relaxing for your nervous system, you know, so it's a really good, well-rounded one. Rebounding, you know, I don't know that that's for everybody. It depends on what your goals are, you know.
Rebounding.
So he was talking about like jumping on a trampoline, basically, you know. So that definitely depends on what your goals are and your physical needs and things. The pelvic floor strengthening can go along with that potentially, but that's usually going to be for somebody with higher level needs, you know. If you're just leaking when you're, you know, sneezing or coughing or going for a walk or something like that, that's not something that probably you would need, you know. But if you need to be able to jump and run and do those things that are higher impact activities without consequences at your pelvic floor, then incorporating pelvic floor training into trampoline work or rebounding could be a helpful adjunct, but not normally.
Wonderful. Thank you so much, Dr. Shimanek, for your time and for sharing all these exercises with us.
Mhm.
Beautiful.